Welcome to I Got a Question Conversations with Dr. S. Welcome to I Got a Question with Dr. S. Today, I have the pleasure of asking questions of a new friend and sister in Christ, Mrs. Cheri Cross. Cheri, welcome to the podcast.
Thank you, thank you, thank you. Thank you for the warm welcome and just being open to
Yeah,
the idea. I'm excited.
me too, me too. So before I get into any of my questions, I'd like you to take a moment to introduce yourself to the people.
Okay, I am Minister Cheri Cross. Yes, Minister. I love the Lord with my whole entire heart. I am a wife, mom, business owner of multiple, not just one, but multiple streams of things going on over
Okay.
here. um, I've got the foundation, the Sickle Cell Foundation that we hold for our daughter and other sickle cell anemia patients. Active member at the Abundant Love Christian Ministries Church, owner of a daycare slash preschool, Nori's Play Place. Look, I've got things going on.
Yeah.
Hello, world. I am Cheri Cross.
I love it. I love all of the things. So ministry, family, business, holding it down with the foundation. I love how you are wearing so many hats and it appears that
Mhm.
you are wearing them well. So kudos to you.
I'm trying. Look, only by the grace of God. Look,
Amen.
because without Him, ooh, Lord.
Amen. Well, speaking of all of the things you are juggling and having go on, you mentioned your foundation. So can you tell us a little bit about what is sickle cell anemia and why is it important for us to know about it?
I've got some notes over here because
Okay.
look, I'm no doctor, but I know what I know as
Mm-hmm.
my family's journey with sickle cell.
Okay.
So I got a couple of few pointers that I went and pulled from Dr. Google because I call him all the time. Like he's one of my favorite doctors. So to put it all together, this is what he said, and then I'll give you for me what it looks like for us. Sickle cell disease is a blood disorder that causes red blood cells to become hard, sticky, and shaped like sickles or crescent moons instead of the round, normal red blood cells. Um, these sickle shapes are also called known as damaged red blood cells because technically they are.
Hmm.
They can get stuck in small blood vessels and causing the blockage of blood flow, meaning like if once a patient is in sickle cell crisis, which is where the pain crisis come from because of the blood cells being blocked, there's no real true blood flow going to the various organs and places that we need
Okay.
it, which leads to the things that sickle cell patients have to deal with, like organ failure. And a lot of people, which is crazy, I hear it all the time. Well, she looks so healthy. Yeah, because she is healthy on the outside, yes, but
Mm-hmm.
what's happening on the inside is where sickle cell disease takes place
Okay.
in the blood, in the arteries, the organs, tissue failure, like all of these things are happening. Like right now, we're getting ready to have dental surgery because her teeth keep dying,
Mm.
all because of the blood flow that's supposed to go to those places and the iron. She's iron, look, they're iron deficient. So all of these things. So yes,
Okay. Okay.
that's what it looks like.
Wow. So I know for me, and we'll probably get into this too, just as a Black person, I've heard of sickle cell anemia. I've seen the diagrams with the sickle
Mhm.
shaped blood cells, but I don't really feel like we talk about it a lot. Like, uh,
That's very
I
true.
can't remember the last time I had a conversation with someone about this. And so I know we're going to get into a little more specifics, but and Dr. Google can probably help us with this. Like, what is the rate of sickle cell disease? Is it only among African Americans? Can anybody be I don't
So
say infected, influenced by it?
we inherit
Okay.
it. And it affects only Black and brown people.
Mm.
So if you've ever run into a person that's not Black or brown and they have it, it's because somewhere in their genetic makeup,
Mm-hmm.
we're in there.
Mm-hmm.
because we're the only, genetically speaking, we're the only ones that
Okay.
inherits it, and we inherit it from our parents.
Okay.
Yeah.
Okay. So now I'm digging back into ninth grade biology with dominant and recessive genes. Is
Mhm.
it that both parents have to be carriers and that is how a child would inherit it? Or if one parent is a carrier and the other parent isn't, they could still possibly have it?
So how it works is that if I were the only carrier of sickle cell trait, then one of my children could potentially carry sickle cell
Okay.
trait. They wouldn't so much be susceptible to having the disease per
Okay.
se. So, but because I carry the trait and my husband also carries the trait,
Mhm.
we now have a 25% chance of reproducing a child with sickle cell disease.
Okay. Okay.
And then you also have a 25% chance of having a kid that's absolutely normal, don't have
Mhm.
anything. But you have a 50% chance. There's more, and I wrote that down. I typed that. I almost say wrote because I didn't write anything. A 50% chance of having a child that just carries the trait.
Okay.
So when when we found out that we were pregnant with Michaela, that's her name, Michaela. When we found out we were pregnant with her, we went through the whole shebang of questions and things that the doctors
Mhm.
take you through. And then they were like, oh, you have the trait and he has the trait. And then that led to a whole nother
Mhm.
series of questions that we then had to go through, also with being informed of my options, because,
Mhm.
they say some people can't financially handle
Yeah.
a child with sickle cell disease, or truthfully mentally handle a
Mhm.
child with not mental with sickle cell disease, because it weighs heavily on you financially, it weighs heavily on you mentally. So they give you your options, and I was
Mhm.
like, well, I'm not trying to take any of those options. I know who I know, and for
Right.
what I know about him, she's going to be just fine
Mhm.
if she has the disease. Um, so, and I'm just like, I didn't understand why they would give us that information, but I understand now.
Mhm.
Like, but during that time, I was really offended. Like, how dare they?
Right. Right.
Like, there's more of a probability for her to just be born with sickle cell trait than there is for her to have the
Mhm.
disease. So why would we? I understand now because
Yeah.
I'm in it and I
Yeah.
understand. So that's the breakdown of it.
Okay.
You get 25, 25, and then 50. So
Okay.
look, go for it, people. Don't let nobody tell you that you can't. Just
Right.
trust God and go for it.
Right. No, I mean, and you're thinking about it like you were saying, we're just excited to be pregnant. We're excited. We were about to have this baby. And so now we suddenly have to have this conversation
Mhm.
about something that maybe you hadn't even been aware of. Now, I'm assuming as a carrier, you knew that before you started planning a family, or no?
I did know. However, I think
Okay.
we're born in that generation of where we knew about it, but we really didn't know about it. I
Mm-hmm.
think we know more now about sickle cell. I mean, I won't say we, medically, they know more about sickle
Mm-hmm.
cell now than they did in the 80s and 70s when most of us were born. Um, so yes, I was aware. I found out at 10 years old that I was a carrier of sickle cell trait, along with another form of something like sickle cell trait. It's called alpha thalassemia.
Okay.
So just by the grace of God, when both of those come together, like, I'm not dealing with, well, my immune system's terrible, but that's a given.
Mm-hmm. Mm-hmm.
But outside of that, like, thank you, Lord. But I have passed both of those traits down to my children.
Okay.
Yeah.
Okay. Yeah, I mean, this is so helpful. Like, we both acknowledge that we are not MDs. This is not our definitely not my area of expertise, which is why I'm asking questions. Um, but I think for people listening, it is important for us to be
Mhm.
aware and it
Mhm.
not be something where we wait necessarily until we're pregnant and have to have those hard conversations with a
Yeah.
medical professional who, may not align with our faith, who may not understand why we're doing the things that we want to do. Being
Mhm.
pregnant is hard, just being pregnant.
Alone.
So let alone getting this information for the first time. So I would
Mhm,
say that, this would be an excellent opportunity to advocate for
mhm.
genetic testing and just kind of knowing your medical history. And
Yes.
this has been a side, hadn't planned to say this, but I will say it because some of us aren't always aware of our family history. We
Yeah.
may not know our biological father or mother or whatever the case may be. And so
Mhm.
sometimes you just have to take it that responsibility on yourself to be like, let me see what's going on with me just so I can know ahead. What are your thoughts about that?
I absolutely, oh my God, agree. I advocate. That is like, if I'm in a room of people, that is the first thing I want to make known. Do you know your status? And then when I say that, they're looking at me like, are you talking about STIs? I'm not talking about STIs. I'm talking about, do you know your status? Do you carry sickle cell trait? Do you know what that looks like for your life? Do you know what that looks like for your children? Does your significant other or spouse carry the trait? Do you
Mm-hmm.
know these things? And in most situations, they're like, oh, well, I know somebody or I have heard of. And I'm like, okay, well, do you know for yourself? Do you know what that looks like? And then that leads to a whole nother conversation of me informing them of what it looks like and why we need to know, because you have the possibility of bringing this child into the world that could potentially have sickle cell disease or carry sickle cell trait,
Mm-hmm.
and what that could look like for their lives. Look, I'm grateful that I have the support system that I have, because if I had to have done this alone,
Yeah.
who knows? Who knows where I would be, truthfully. So
Mm-hmm.
I'm grateful. And a lot of the parents on this side don't have the support, because like I said, a lot of them are Black and brown families. And that's really not something that we have, many
Mm-hmm.
of us. So
Mm-hmm.
but yes, I definitely advocate for it. Like, look, no, be for sure.
Yeah.
And then also in my family, I was trying to remember what you said, and I was like, yes, I need to say that. For me, I knew on my mom's side,
Mm-hmm.
I was the only one. I am the only one on my mother's side with sickle cell trait.
Okay.
I did not meet my biological father until I was 18.
Mm-hmm.
And on his side, I have sisters that either carry the trait or have the disease. So I'm like, okay, I
Okay.
got it from him.
Mm-hmm.
So yes, because we don't know truthfully where we came from or
Right.
who, be proactive in finding out.
Yes. Yes.
Ask your doctors.
Yes.
Tell them you want to do a full workup. You want to know everything. I tell my doctor that at least once a year, and I know
Mhm.
she's sick of me, but I don't care because I want to know.
Right. That's what we have
Especially because
insurance for.
for us, true, and especially since I just figured out, well, I'm not 18 anymore, and my father's passed on as of last year, but
I'm
I
sorry.
really didn't get that time to sit and figure, get his health history and things like that. I know
Mhm.
a few things, but I don't know everything.
Yeah.
And because I don't know everything, I'm just like, look, doc, send me to get the labs. I'm going because I
Mhm.
want to know.
Yeah. Yeah.
So be proactive for yourself.
Amen. Now, your daughter, is she your oldest or your youngest?
Oh my. So here's my disclaimer.
Okay.
I have two sets of children.
Okay.
Okay. I've got young adults and then I've got the littles.
Okay.
So she is the firstborn of my littles.
Okay.
And my baby girl, she does carry the sickle cell trait.
Okay.
So we were given the 25 and 25. Thank you, God, for that. I'm
Mm-hmm.
okay with that.
Mm-hmm.
My older two, um, my oldest is she doesn't have anything outside of being a brat. She's the oldest and she's a girl, so she's a brat. And then my son, he is the carrier of alpha thalassemia. So
Okay.
that's what they got.
So for people who may be listening and they're thinking about, starting a family, kind of, and if this is too personal, let me know. Um, just having them think about like what questions should they ask themselves if they are a carrier of a trait of this or some other disease. What what would you suggest that they think about before they become a parent?
before becoming a parent, always, like I said, always know your status.
Okay.
Ask that doctor to give you a full workup so that you know if you are borderline diabetic, if you are borderline this, or you have, let's say, the cancers in your family makeup, know exactly what you're coming into. So then that way, when you're having conversations with your significant other or spouse or soon to be spouse, let them know. And then
Mhm.
also ask them because you want to know. Ask them so that then you know what your kids could potentially
Mhm.
come up with.
Yeah.
I'm an advocate, look, for also
Mhm.
communicating. Communicate. That's like my number one thing. If you can't talk to your partner or person that you're in a relationship with, then what are y'all doing?
Mm. Right.
So
Yeah.
yes, definitely have those conversations.
Mhm. Yeah, that's probably one of those hard conversations. We talk about, money and faith, but this is, health status is another very, very important topic that I mean, I
Mhm.
don't think I had those conversations beforehand. So for those individuals who maybe already have children who either are carriers or who have the disease, what are some things you've learned in this process or suggestions that you can offer to them as they go through the process?
With their children or
Yes, with their
okay,
children.
with the children that's the carrier or that has the disease.
Yes.
Um, if you have children that are carriers of the trait, make sure they're aware of what that looks like. Just don't, let them grow up and not know. Because medically speaking, most doctors will say that if you have the trait, if you're the carrier of the trait, then you really don't have any issues. That's what they say.
Mhm.
But like I said, I'm a carrier of the trait and my immune system's terrible. That's for me. So just assuring that your child that has sickle cell trait is aware of what they have and to be open to having conversations with boyfriend, girlfriend, husband, whoever it is down the road, so that they're in the know versus not knowing. And for the parents that are on this sickle cell journey with me, look, stay strong. Keep those kids informed of what's going on with their bodies.
Mhm.
Michaela is 7 and she's quick to tell me if I'm looking at her like, okay, well, something's wrong with you or something's bothering you. And she's quick to tell me, Mommy, you tripping.
Okay. She said she
I'm
know her
fine.
body.
Yes. Assure that your kids know their bodies and are able to voice to you when something's wrong. Like for Mother's Day, Michaela said, it seems like every Mother's Day we're in the hospital.
Mm.
And I don't want to be in the hospital in her mind, she didn't want mommy to have to be in the hospital for Mother's Day again. Literally the past 4 or 5 years we've been in the hospital for Mother's Day.
Mhm.
So she made up in her mind that she didn't want to tell me that something was going on with her, which I'm like, I know because I'm your mom and I can tell. I
Mhm.
can tell. And so she was like, she looked over at me and she said, well, I'm fine. We're not going to be in the hospital for Mother's Day. We're going to get through this weekend and I'm going to be just fine. And I'm like, in my mind, why are you telling me this?
Mhm.
Are you telling me this because you want me to believe that you're okay? It doesn't matter if I have to do every Mother's Day in the hospital, Father's Day, Christmas, birthdays. It doesn't
Mhm.
matter what it looks like. If we have to go to the hospital, we're going. As your mom, you're my number one priority. So make sure that your kids know that they're the number one priority, all of them. Even if you don't have kids with sickle cell disease or sickle cell trait, make sure, like if you are a big family like ours, where we have the one with the disease and then the trait and then the other things, I
Mhm.
assure that all four of them know that they are the priority for us as their parent.
Yeah.
That's my advice.
So let me ask you this because you had mentioned the financial component, the mental health component. I'm sure, like, assuming the insurance component, what are some things you learned about that that you could share with our listeners?
Ooh, financially, sickle cell will take a hit. Okay. Um, and that's part of why not just myself, why we established this foundation because it's hard.
Mhm.
And my husband, even he mentioned it, he was like, if this is what it's looking like for us, what is it looking like for the single parent homes? because like my husband, he worked for the United States Postal Service since he left working for the military, since he separated from the military. Like we went from one government space to another government space, okay? um, and even though they have these FMLAs and things like that in the setup for you, it still does not matter.
Okay.
If you then don't have like the PTO or saved up time and all of these things is necessary, if your child is sick and has to be in the hospital, and if you're from a big family like ours, if I'm at the hospital with Kayla, then who's at home with the other kids? So now dad has to call off work to be at home with the other kids, or leaving work early to pick the other kids up from work. And that I'm not work for school. Jesus, from school. So now then that means hours are being cut short, then pay is being cut short. Like financially, in the beginning, it was like hit or miss. And I'm just gonna be real transparent. It was hit or miss. It was either, who was this? Can you see me? I'm here.
Yes.
Somebody had the audacity to call me. I don't know why I just didn't turn it off. It was either hit or miss financially. And I was just like, okay, God, I know you didn't get us here for it to be like this. So either we're gonna have to have some relief from this sickle cell, or we're gonna have to have some extra finances coming through. So then that's when we went to the journey of becoming business owners, which works. Oh God, it's so beneficial. Now being that we are business owners of the daycare, it works. See, because now we're not having to call off or call in. Our parents are like, oh no, Kayla's in the hospital. We understand. And having the support and backing of our parents is another amazing option. I'm grateful for them.
Awesome.
So, I mean, financially, mentally, oh my God, it had even gotten to a point, and I'm not going to give all of his testimony, to where my husband was like, he's already prior military, so he has mental health issues from that, right? So then we get over here to life and things are happening with his baby girl. So now it's taking a toll on him. And I'm just like, okay, Lord, what's happening? What are we doing? Because this man, this my husband, I'm watching him, because I don't even know how to explain it. Like, if you just being a parent watching your child fight for their life. Not like, I want to say maybe last year, the end of November throughout maybe all of December, Michaela was in the hospital like every other week. And she wasn't just in the hospital for small things. Kayla, she was in the hospital with acute chest, and acute chest alone is deadly. It's where infection shows up in the lungs, which then affects the breathing and all of this thing and all of those things. So we're watching her. Like, I'm there and I'm trying to be strong, and then he's on the phone trying to find out what's going on, because we want to, we just want her to be better and to be like healthy. And during this time, she's just like, Jesus, it was bad. Okay. So him seeing that, it's a struggle. And I'm trying not to go too much into his testimony, because that's his testimony. I'm sure he don't mind me telling it, but I want him to shout it out to the world of what God has done for you. But yes, financially and mentally, oh my goodness. People said all the time, like, I don't know how y'all do it. By the grace of God, that's it. And then I also think that some people are not aware of actually what it looks like. So they're just like, what do you mean she was in the hospital fighting for her life? Like, how? Because the next week she was out doing flips. Because that's what it is. That's literally what it is. It's like, okay, they can be in for a week or two, sometimes maybe even a month. On this bed fighting for their lives, and then can be out of the hospital for a week ready to go back to gymnastics. That's our story. Because that's Michaela. She's like, she doesn't allow it to bring her down. I think one time she got out of hospital on a Tuesday and she had gymnastics that night, and she was like, I'm going. And I'm like, no, you're not. We just got released from the hospital. So financially, it is terrible if you have to do this thing alone. And the companies, they don't care. The
Right.
companies do not care. You're disposable. They try, but as soon as you have to get into a pattern, if in the cold months when it's really cold and their bodies are doing what it does, like joint pain from it being so cold outside, and if they're going to school, then they're open to, flu, pneumonia, colds, all of these things that they can now catch, and they do catch from the other kids at school. And now you're in a more frequent pattern of having to call off because now your kid is either at home sick or in the hospital sick. So yeah, financially and mentally,
A
just
lot.
it's a lot. Yes.
A
Took the
lot.
words right out of my mouth. It's a lot.
Yeah, even as you're describing it, I'm thinking on, just typically if you have a child and they get sick or you have to not go to work. So to imagine that on a exponential level of,
Hmm.
the all of the different symptoms that you mentioned and having to deal with it, it's no wonder
Yeah.
that it could be a strain.
Hmm.
Financially, it can be a strain on your and the child's mental health, and how I can see how having that support system, whether that's in the house with your, spouse or partner, your family, extended community, whomever, why that would be so important. So speaking of, building community and having that support and that network, tell us a little bit about your foundation.
Oh man. So we established the foundation in 2022. Originally I would do like small caliber things, like just donate to she's a patient at the Bob Costa Center at Cardinal Glennon. So I would do like small caliber things, donate care packages for the sickle cell patients, or I think one year we made capes and masks for sickle cell World Sickle Cell Day, just small things like that. But um, originally, when establishing this thing, I knew the Lord was like, "No, this is what we're doing, and get your life together." And I was just like, "But I don't know." Let's just try this. Like I was really, really just putting things, just doing stuff, even though I knew what he was telling. I knew what he had, and I knew it. And today I still know it. So I'm being proactive in this thing now, just to try to assist the families, because I was talking to one of my friends. Actually, Michaela was just in the hospital 2 weeks ago. And I was talking to one of my friends while she was in the hospital, and I told her, I was like, being in here is weighing on the parents, as we've already discussed, and um surviving off of cold cuts, because you either DoorDash something, which that can become expensive. You can eat off the guest menu, which is basically whatever Kayla's having, I can have, which is terrible. Hospital food. Okay. But and I was telling her, I said, I can only imagine what this looks like for parents that are having to be here long term and having to survive either off of the hospital menu. Door dashing too much is terrible for the budget and finances. So
Right.
like that was the reason behind establishing the foundation, because what does it look like if we can take some of the burden off of the parents, if they know that we exist and they can call and say, hey, my child is here for ABC reasons. We've been here for such and such days. Cool. Just call and let us know, and we'll do the rest. And that's delivering a meal, because I now, since COVID has been lifted, we can go and take them a meal if that were the case. Also, just witnessing the families having to come in and either not have um, transportation. Oh my God. Last year, I witnessed Kayla's doctor pay for an Uber for a family to get home.
Oh,
Now,
wow.
look, she's a doctor, and people just say, "Oh, she got it. It's okay." But what if she didn't have to do that? What if it were? Now, I know there are some foundations that just donate bus tickets and things like that, but if you're in the dead of winter,
Yeah.
and this child that already has this that's immunodeficient, If they're too cold, then they can go into pain crisis. If they get too hot, they can go into pain crisis. Sometimes public transportation is not a good option.
Right.
So that behind the foundation, if we can pay for an Uber to get them to and from their appointments, if we can supply the parents with meals or even the families back at home, because like my husband can't cook. Love him to death, but cooking is not his thing. Okay,
Sure.
the kids will they'll survive off of what is it, Jack's oven pizza
Mm-hmm.
or noodles. And if Michaela's gone, if we're in the hospital for a week, then my kids are probably eating Jack's pizza and noodles. So if we can provide a nutritious meal
Yeah.
for the families at home,
Okay.
let us do that. So
Mm-hmm.
that's why we need community support, so that then we have, because my husband is just like, look, you got one more time. You got one more time. Send another DoorDash to the hospital. I'm sorry. And then we make friends with the other sickle cell families. So of course I know.
Right.
So of course I want to help. And he's just like, all right, now I can see the Uber from point A to point B.
Mm-hmm.
Send another DoorDash.
Mm-hmm. Listen, it's
So
hard to
I'm
hear.
taking away from, look, our already,
Mm-hmm.
stressed financial situation. And he's just like, look, we gotta figure this thing out. When he
Mm-hmm.
set me down and said, we've got to figure this thing out, I see where the help is needed. I see where we can step in to be whatever what we need to be for the people. I see it.
Mm-hmm.
So how do we get there? And I'm just like, okay, man, I hear you. Let's do it.
Right.
He was sick of me at that point. He sent another DoorDash.
That
Like,
is
what?
so funny. Well, I mean,
I
and
said, I told him, I said, I'm okay with having cold cuts. Other people's, they just may not. And if
right.
cold cut is an option, now look, and then he fussed at me for paying $7 for a cold cut. Because if you are a parent, like I said, you can get a guest tray at the hospital, but it costs you $7.
Mm-hmm.
$7 breakfast, lunch, and dinner. That's $21 a day.
Mm-hmm.
Okay, that adds up if your child is there for a week.
Right.
And then some people are like, well, maybe they just don't need to be eating. They should be worried about their child. What?
Right. You gotta take care of yourself.
You have to take care of yourself. So what happens if mom or dad breaks down?
Mm-hmm.
So I was like, that makes no sense. No, that makes no sense.
Right.
So, but he fussed at me. He was like, you're eating cold cut. You're paying $7 for a sandwich. I'm like, well, yeah, you told me not another DoorDash. You said for the other people.
Right. Well, you gotta do what you gotta
You need
do.
If you need to
And
DoorDash for yourself, just don't pay $7 for a cold cut.
right. Well,
I'm like, well, what if I pay $7 for pancakes?
right. I
He's just,
love how I'm sure there's some quote somewhere that I'm about to mess up, but you know how things like this, like your foundation, are born out of adversity and need. And you saw a need, not only for
Mhm.
yourself, but for the community that you're a part of. Now, tell us the name of the foundation.
It's the Kayla Ray Hope Foundation.
The Kayla Ray Hope Foundation. And I know you guys have an event coming up in a
Yes,
couple of weeks. So tell us a little bit about that and how we can support you.
absolutely. So we are hosting our first sickle cell anemia walk.
Okay.
Yay!
Yes.
So in doing that, you can register either on our website, but one of my board members said, no, just have them contact you. But you can go to our website, which is KRHF, is just basically Kayla Ray Hope Foundation .org. You
Okay.
can register on the website. You can for sure reach out to me. I'm on Facebook. My name is, what is my name on Facebook? I have no idea. I believe it's Cheri L Cross. We also have a Facebook page for the foundation, which is Kayla Ray Hope Foundation.
Okay.
All those options to reach out to me. You can call me 618-225-1500 to register for the walk, to be a
Okay.
support of this amazing community of people that need, look, we need to be supporting each other.
Yes. Yes.
We need to be supporting each other.
And it's on Saturday, June 22nd, right?
Saturday, June 22nd at 8:30 is when the registration open. The walk starts at 9 a.m.
Wonderful, wonderful. Well, I am confident, and we were talking offline about how I can be of support and offer a donation, because if this isn't something, as we started off with, that you personally have dealt with or know someone who's dealing with, it's not even on your radar, but that does not mean that there's not a need and that we can't help to fill that gap with that need. How much is it to register?
It is, so we got a lot of different registration options. It's $30. With the $30, you'll receive a t-shirt, which will be just a Kayla Ray Hope Foundation t-shirt, a light lunch. You'll have access to light breakfast options. We're gonna do some raffles for the support. Look, you show up, we want to give you something. We want to love on you just a little bit. Then you also have the option to not buy a t-shirt or not get a t-shirt, and that's $25 to register. So all of that information is on the website as well. Also on the Facebook pages. Check all of those things out.
Wonderful.
Go.
Wonderful. I will be sure when I post this to list the website, the Facebook pages, the telephone number, all of that, so people can be sure to have an opportunity and a way to find you. And here's the thing, here's what I'm thinking. I eat, you know what I'm saying? You go out to eat, you don't spend $25. So here you are, we have an opportunity to sow a seed into what sounds like a fantastic foundation to help a group of people who have heard it is a financial challenge. It could be a mental health challenge. And so wouldn't it be great if it was one less thing that they had to worry about? They ain't have to worry about the $7 cold cut sandwich. They don't have to worry about the DoorDash fee. So I think this is a great way to, be a blessing and to learn something that maybe we didn't know. So are there any final thoughts that you have as we wrap up?
If you don't want to register for the walk, donations are always accepted. If you want to come but are unable to walk, but still just want to come and just be out for support, for sure come out just to support. We will have, trying to work it out so that we'll have Impact Life come so that we can also do a blood drive as well.
Oh, wow.
Kind of do a 2-in-1 if we can. And then if not blood draw, then also if you don't know your status, come out. They'll be out there to let you know.
Yes.
Impact Life, they will be out there to let you know. They can do a quick finger stick and say, hey, this is your, I think she said they can do blood type. They can let you know if you have sickle cell trait. I believe that's what she told me. If your iron's low, all of these things just with a single finger stick. So we've got some stuff going on, and it's going to be a very exciting, fun-filled, community loving on this community day. Did I say that right? Yeah. The community loving on this community. Yes.
I love it. It is so exciting. So Cheri, I just want to thank you so much for just such a good conversation, inspiring, and thank you for educating us on this topic that is clearly very important for us Black and brown people. And if you don't have any other words, and I just want to say thank you because all of my questions have been answered.
No, you're welcome. Look, and thank you for having me. Look, supporting this. I'm appreciative. Okay.
Of course. At the end of the day, we're all family. That's how I look.
Yeah.
All right. And so speaking of family, I want to thank our virtual family for hanging out with us and listening to I Got a Question Conversations with Dr. S. If you haven't already, be sure to follow me on Spotify or Anchor, or subscribe to my YouTube channel. And we'll see you next time with more questions. Be blessed, Dr. S.
Be blessed.
Thank you for joining us for another episode of I Got a Question Conversations with Dr. S. Be blessed, Dr. S.